U.S.-style question, acute hemolytic transfusion reaction, AHTR. A 55-year-old man with end-stage renal disease is admitted for a blood transfusion due to symptomatic anemia. Shortly after receiving a unit of packed red blood cells, he develops fever, chills, chest pain, and dark urine. His blood pressure is 90/60 mmHg, and his heart rate is 110 BPM. Laboratory studies reveal hemoglobin 7.5 grams, lactate dehydrogenase LDH elevated, haptoglobin decreased. Direct Coombs test, urinalysis, hemoglobinuria, no RBCs. Which of the following best describes the underlying pathophysiology of this patient's condition? A. Immune complex deposition in small vessels. B. Preformed IgE antibodies activating mast cells. C. Preformed anti-ABO antibodies causing complement-mediated hemolysis. D. Delayed destruction of transfused red blood cells by IgG antibodies. E. T-cell-mediated attack on transfused donor leukocytes. Explanation. This patient is experiencing an acute hemolytic transfusion reaction, AHTR, a type 2 hypersensitivity reaction caused by preformed antibodies, IgM, against incompatible donor RBCs, leading to complement-mediated intravascular hemolysis. Pathophysiology of AHTR occurs within minutes to hours after transfusion. Performed anti-ABO IgM antibodies bind to donor RBCs, activating the classical complement pathway. Leads to intravascular hemolysis, releasing free hemoglobin into the plasma and urine, hemoglobinuria. Cytokine release contributes to fever, hypotension, and shock. Clinical features of AHTR: sudden onset of fever, chills, flank pain, and dark urine, hemoglobinuria. Hypotension and tachycardia due to systemic inflammatory response. Jaundice due to bilirubin release from lysed RBCs. De-ice in renal failure due to hemolysis and free hemoglobin nephrotoxicity. Laboratory findings: LDH, haptoglobin, hemolysis markers, hemoglobinuria without intact RBCs in urine. Positive direct Coombs test detects complement or antibodies on RBCs. Management: stop transfusion immediately. IV fluids to maintain renal perfusion and prevent acute kidney injury. Pressors if needed for hypotension. Correct answer C. Preformed anti-ABO antibodies causing complement-mediated hemolysis.